Thank you everyone for joining us today. My name is Britton Slagle. I am the founder and executive director of KarmaSue. Our mission is to support Coloradan families enduring companion animal cancer through education, counseling, and financial assistance. We want to thank you again for attending our first online education workshop today. If you are interested in watching any of our previous workshops, please visit our YouTube channel. And if you have any questions or would like to connect with us directly, you can send us an email at admin@karmasue.org. We're hosting this workshop in partnership with the Brodie Fund. Their mission is to raise money to offer financial assistance to families who have pets fighting cancer. You can learn more about the Brodie Fund on their website at thebrodiefund.org. Today's workshop is titled Managing Stress in the Pet Professional, Pet Parent, and Pet while Treating Cancer. Our special guest facilitator is Dr. Katie Woodley. Dr. Woodley is the proud owner and expert holistic veterinarian of The Natural Pet Doctor. The Natural Pet Doctor is transforming the pet healthcare system through Dr. Woodley's expertise, innovation, and care. By integrating holistic medicine such as acupuncture, herbal medicine, and nutrition into conventional treatment plans, she is improving the efficacy of treatments and enabling pets to live longer and more vibrant lives, regardless of the pet's location, through phone consultations and house calls. We'll have a Q&A section at the end of this workshop. Should you have any questions, as we go along, please enter them into the Q&A in the little chat box below, and Dr. Woodley would be happy to answer questions as time allows. Thanks again for joining us today. And now I'll hand things over to Dr. Woodley.
Thank you so much, Britt. And I wanted to thank Britt and KarmaSue for having us here today. So once again, I'm Dr. Katie Woodley with The Natural Pet Doctor, and I'm so excited to share this information about a really important topic. So as Britt mentioned, we're talking about managing stress in the pet professional, pet parent, and pet while treating cancer. So let's get started. So this is Finn. He's unfortunately not here with us any longer, but his story is very important for what we're going to be talking about today. Finn was an 11-and-a-half-year-old German Shepherd who unfortunately started having seizures. If anyone here has had a pet with seizures, those are really hard to watch a fur baby go through. His mom took him to the neurologist and had a CT scan done, which unfortunately showed a brain tumor. The brain tumor was why the seizures were happening. The neurologist gave Finn's mom a few treatment options. He needed to go on prednisone and seizure meds immediately due to the brain swelling. He had the option of having brain surgery to try to remove the tumor or radiation treatment, which involved anesthesia every week. And there was a very high risk of him going blind since the tumor was right by his optic nerve. If you've ever been there trying to make the best decision for your beloved pet, it is hard. Finn's mom was told that he probably had a few weeks to a month at most if they only did the prednisone and seizure medications. But then the other alternatives possibly gave him more time, but had a good chance of some pretty severe side effects. Finn's pet parent went home with him and started on the meds, which he did horrible with. Severe side effects, not eating, vomiting, diarrhea, and he couldn't even stand because he was so ataxic or wobbly from the drugs. And Finn had never missed a meal or been sick prior to this. At this point, most people would lose hope because now their beloved can't tolerate drugs, and the neurologist has told them there are no options. Well, this is where the story gets interesting because Finn was my soul pup and I was his pet parent. Being a veterinarian, I knew when he started having seizures that he probably had a brain tumor because that doesn't just happen with an older dog. However, I had to break that news to my wonderful husband who didn't know that. So while I was hugging and crying over Finn while having a seizure, I had to tell my husband what was going on and what it meant. When I was told there were no other options, I was lucky to provide my own dog with another option because I practice holistic medicine. However, many pet parents are not given that other option. Finn thrived for another 10 months without pred and a very low dose of seizure meds because we utilize CBD, herbal medicine, and other supplements to slow the cancer down. He ultimately lost his courageous battle recently with cancer at the end of March, but I feel so blessed and lucky I had another option and the tools to help him. However, Finn's story showcases the stress of being a pet professional. To give the diagnosis, tell a pet parent there is nothing more. Watching a patient go through the cancer journey as a pet parent and pet professional, and the stress that comes with the ups and downs of that journey, with the ultimate decision being when to help your pet pass and hoping you made the right decision at the right time. Who else has been there that's on this call? I'm Dr. Katie Woodley with The Natural Pet Doctor. As you just heard, my passion is holistic medicine. Years ago, I was tired and stressed from being the vet who was telling pet parents there was nothing else we could do for their pet. I was not okay just watching a pet become sick because conventional medicine had no other options. I became certified in acupuncture and Chinese herbal medicine and started integrating these treatments into my conventional treatment options and found pets were thriving and overcoming diseases that shouldn't improve. My mission is to create healthier pets and happier pet parents through holistic medicine, regardless of location. There are not enough holistic doctors out there, and we will change that through education like these webinars, but also providing telehealth options for pet parents that need help and don't necessarily have a vet near them. Today, we're going to be taking a deep dive into what is stress. How does it affect everyone involved with taking care of pets and the pets themselves? We'll go through the signs of stress, what the effects of stress are, and most importantly, how to combat stress in people and for the pets. Let's start with the emotional journey of a pet parent and the pet professional when a pet is diagnosed with cancer. As we all know as pet parents, the bond between us and our pets is pretty intense. For many people, their pets are all they have in their lives. They don't talk back to us and only provide unconditional love. Thumbs up if you've ever had a dance party with your pet in your house. Your friends and family might think you're crazy, but your dog is always down to celebrate with you no matter what. Maybe not cats, but the dog will. But when they get sick, it affects the whole family. You might notice them eating less. Maybe they have less energy or just aren't acting right. Maybe you notice swellings in the front of their neck or behind their knees. We tend to tell ourselves we'll give them a few days to see if they pick up, and then we take them to the vet. After watching them and not seeing our pet not get better, and our stress and worry is now really high, we put them in the car and we take them to the dreaded vet clinic. You might have a dog or cat that hates going to the vet, and this adds a whole nother element of stress to you and your pet that's not already feeling well. Maybe you're even thinking, I hope this doesn't cost me a fortune. We're short on money this month. Hopefully there's nothing wrong. So after dragging your dog into the clinic or bringing your howling cat in, who's been there? I know I have. Even as a vet, you now have to sit in the waiting area. You're watching pets come and go. Some look really sad and sick, and others seem happy and are probably there for a wellness visit. However, your pet might be like that picture. They're freaking out, and you're trying to comfort your stressed pet, knowing that something is going on while you're trying to calm your nerves and worries over what is happening to them. Finally, after waiting for what seems like an eternity, you get into the room. It's not much better. The cat is stressed, trying to hide or get to the highest spot in the room to escape. Your pup is panting excessively. They might be shaking. You might even hear the doctor giving another person a bad diagnosis or a person crying in the room next door. Sitting and waiting while trying to calm your pet and you're worried about their health is hard. The doctor finally comes in. The doc might seem a little stressed and worried. Maybe they're running behind, but you've been seeing this doctor for years. They know your pup, your cat from when they were a baby. They get the history about what's been going on, and they start doing a physical exam. As they feel the enlarged swellings, you notice that their facial expressions change. What's wrong, doc, you might ask. As a doctor, we know that feeling that especially in that area of the lymph nodes in an older dog, that the chance of it being a cancer like lymphoma is pretty high. But as the doctor, our job is to reassure you that we don't know anything for sure until we take those samples. This is how I felt with Finn and having to tell my husband that he probably had a brain tumor. It's difficult knowing that we may be giving a cancer diagnosis, which is one of the hardest to receive as a pet parent. However, our job is to stay calm and collected, even though we feel so attached to our patients, especially if we've watched and helped them grow up through the years as our patient. Another part of this journey are the amazing vet nurses. These incredible people are very attached to your pets. They are here for the animals and definitely not for the pay. When a pet gets sick or receives a cancer diagnosis, many times the vet nurses take it as hard as the pet parent. However, these incredible people also take the brunt of people's emotions. They are first to get a history, and if the vet is running behind because of emergencies or all the sick pets that have been crammed into the schedule, the nurses are the ones that get the upset clients. They are also the ones that stay with the pet parents when the vet has to rush out and attend to a hit-by-car patient just after giving a cancer diagnosis and the client is crying. The nurses are truly here to help you and your pets, and a cancer diagnosis hits a vet team hard. After getting samples, the vets and the vet nurses look at the samples and run the blood work. This is when we now can usually confirm that we are most likely dealing with a cancer. Getting the courage and the poise to go back into the exam room to tell a client the worst news that they had been dreading and hoping against was not the case is really difficult. Even though vets did not give the pet cancer, making people cry because of what we have to tell them wears on the heart and soul. This can be a daily occurrence that is mixed in with euthanasias and other difficult conversations. The vet team is hit hard when we see these sick pets, especially if we've all gotten to know them and their pet parent. Gaining courage to not cry and tell people the devastating news is really difficult. Stress affects everyone in different ways. Most people go quiet or start crying, but there are people who go to anger and blame when we give a cancer diagnosis, especially if there are no other options that can be given for treatment, or if money is an issue for treatment. One of the most common things we hear in the vet world is that we're in it for the money and not for the pets. Unfortunately, veterinarians have one of the highest suicide rates out of all professionals. Many people do not know this staggering fact. Many have staggering student loan debt, low-paying jobs, and the emotional strain each day can take its toll on the veterinarian. Many pet parents will enter a severe depression and start trying to find why their pet got cancer. They will blame themselves for not doing enough, or maybe say a certain food caused it. It's difficult to not receive an answer to why it happened, and usually there's no exact reason for why a pet develops cancer. The next few weeks to months can be a roller coaster for pet parents emotionally. There's a lot of stress, and pets tend to have good days and bad days. Everyone deals differently with a sick pet and their emotions. Some have good support systems and others are alone. And then there's the vet professionals. I have laid awake many nights thinking about my pet patients, wondering what else we can do or if there was something different that we could have done for them. The biggest takeaway in this is that we are in this together. The vet nurse, the pet parent, and the pet. The stresses are all different, but we all want the same thing, a happy and healthy pet that lives a long and vibrant life. This is something to remember for everyone, especially when we're tired and having a long day. So what is stress? Let's lighten the mood a little bit after that emotional journey. So I'm pretty sure we've all felt it at some point in our lives, especially lately. Who here has felt stressed with what's been happening in the world? You can thumbs up to that. You can make a comment in the comment box. So stress is a physical response to something you feel threatened by. There are good and bad stresses. We need stress in our lives to push us to meet deadlines or hit goals and get out of our comfort zones. And then there's chronic stress and anxiety, and that can lead to physical illness and issues. Anxiety is an emotion that's triggered by stress. You may feel apprehensive, nervous, or scared, and this can be due to unknown or imagined future dangers that result in normal physiologic reactions that are associated with fear. You may notice your pet may appear stressed for no apparent reason, or for you, you feel like you shouldn't be stressed. So some of the common signs of stress in people include elevated heart rate, sweating, GI problems, stomach ache, fatigue, irritability, hair loss, nervousness, emotionally reactive. The list goes on. You may be thinking, you know, I have some of those signs and symptoms right now. So those are the signs of stress in people. So what are the signs of stress in your pet? Along with symptoms of cancer, so already your pet may be feeling lethargic or more tired, their appetites are down. And so if you're stressed, our pets are very connected to us. So they may pick up our stress and some of the signs that they can show. So if we're talking about dogs, we may notice that they have excessive vocalization. So they're barking more. And it's not a normal bark where the UPS truck is here or someone's here. They may be barking for no reason. They may have excessive yawning. If you ask, especially if you ask them to do something and you're finding that they're yawning all the time, that might not be because they're tired. They might be pacing your house. Lethargic, that could be from stress, that can be from cancer. Decreased appetite can be from either one. Tail chasing is another symptom or sign of stress. Excessive grooming can be an issue also. A lot of dogs will actually lick and groom themselves until they've created a sore on their leg in one single spot. And also aggression or changes in behavior. For cats, we might find they're hiding under the bed more, so avoidance from people. Lack of or over grooming, so they might start licking themselves more, or they may not be licking anymore. They may be getting mats. They could have decreased appetite. The number one thing may be inappropriate urination or defecation, so peeing and pooping outside the litter tray. They might start spraying inside the house if they're picking up on a lot of stress in the house. Cats are very, very sensitive to changes and stress. They might start vocalizing, especially at night. Pacing. They may also have some aggression issues too. So why is stress so important to recognize? So recognizing stress in ourselves, it's vital to help us navigate. However, as we talked about before, chronic stress can turn into debilitating disease like anxiety. And we're talking about cancer today. However, chronic stress can actually lead to other chronic disease states like autoimmune disease or even cancer. So it's very important that we recognize those signs of stress so that we can remedy it. And for our pets, it's the same thing. We need to recognize that their levels of stress so that we can reduce those for their overall well-being. Otherwise, we can see other changes, other chronic debilitating disease, separation anxiety, diarrhea issues, and of course, if they don't have cancer, chronic inflammation can lead to cancer. So let's talk about compassion fatigue. Do you feel emotionally numb or drained at the end of the day? Do you enjoy your work, but feel like you have nothing left to give? Do you hold yourself to unrealistic expectations? Maybe you feel like you and you alone know how to care for your sick pet or should be the only one to do so. If you answered yes to any of those questions, you might be suffering from compassion fatigue. Compassion fatigue is also known as vicarious trauma, secondary traumatic stress, or secondary victimization. And it's the result of a medical caregiver's unique relationship with a patient through which empathy allows the caregiver to take on the burden of the ill or dying patient. So basically, it's a low-level chronic clouding of caring and concern for others in your life, whether you work in or outside the home, in the vet clinic. But over time, your ability to feel and care for others becomes eroded through overuse of your skills or compassion. So veterinary professionals are very much at risk for compassion fatigue. Like other caregivers, we deal with death and illness on a daily basis. We have to deliver bad news to clients, deal with animal cruelty, and see clients struggle to balance financial needs with the needs of their pets. Research shows that veterinarians face ethical dilemmas 3 to 5 times per week, and such moral stress is a primary contributor to compassion fatigue. Here are a few examples that happen in the day of the life of a pet professional. The beloved family member, Fluffy, lies in the back on the table while the team tries to revive an animal that's been hit by a car right in front of your client. Nothing prepared you for this part of the job as a veterinary professional. The intense tales of trauma, illness, even abuse and neglect. You walk out of the room fighting the urge to cry. Nowhere do you remember reading that being a veterinary technician meant reliving horrible moments with pet parents. You often face scared and angry people, even when an emergency hasn't happened. The stressed out new puppy pet parent who has no clue how to raise this pup, the elderly pet parent of the geriatric cat who are both facing a slow decline as age advances, a healthy middle-aged dog coming in for a wellness exam with a pet parent who's fearful of the test results and syringe pokes. We as pet professionals face traumatized clients nearly every day, often without ever acknowledging the effect it has on us. And if you're a pet parent, watching your pet pass away in front of you can be traumatizing. Getting a cancer diagnosis and maybe remembering how a family member passed from cancer, or being all alone to care for a pet and you feel alone and unsure what to do. So what does this all mean? Caring for a companion animal or any being that has fallen ill in any capacity is difficult for all involved. It's okay to not be okay. Please be kind to yourself. Know that you're doing all that you can with all that you have. And also remember that pet professionals are going through many stressors also, and may also be experiencing compassion fatigue alongside you. We are all in this together. So compassion fatigue consists of 2 parts: burnout, secondary trauma. So compassion fatigue and burnout are similar, but not interchangeable. Compassion fatigue is the result of a medical caregiver's unique relationship with a patient, through which empathy allows the caregiver to take on the burden of the ill or dying patient. Compassion fatigue has a more rapid onset, while burnout emerges over time. Burnout is the cumulative process marked by emotional exhaustion and withdrawal that's associated with increased workload and institutional stress. It's not trauma related. And remember, stress is normal. It comes from all aspects of life: home, work, relationships. Stress is a natural physical and mental reaction to life experiences. Everyone expresses stress from time to time. Anything from everyday responsibilities like work and family to serious life events such as a new cancer diagnosis or the death of a loved one can trigger stress. For immediate short-term situations, stress can be beneficial to your health. It can help you cope with potentially serious situations. Your body responds to stress by releasing hormones that increase your heart and breathing rates and ready your muscles to respond. Yet, if your stress response doesn't stop firing and these stress levels stay elevated far longer than is necessary for survival, it can take a toll on your health and affect your ability to be resilient to the trauma experienced. Many pet professionals and pet parents who have dealt with a cancer diagnosis or a pet death are experiencing traumatic stress and may not be recovering appropriately or even know it's happening. Psychological trauma, according to the Diagnostic and Statistical Manual of Mental Disorders, occurs when an individual experiences an event involving death or serious injury and feels intense fear, helplessness, or horror as a result. Primary stressors are those inherent in the extreme event, such as what was immediately experienced or witnessed, especially those things most contributing to traumatic response. So in the pet world, this could be a pet dying suddenly from cancer, a person yelling at a veterinarian and blaming them for their pet's death, or an emergency type situation with really high emotions. So what are some of the symptoms of compassion fatigue? Remember, stress is an important part of compassion fatigue. Feelings of apathy and isolation are at the top of the list of symptoms of compassion fatigue, but they are far from the only ones. This insidious disorder can cause problems both psychological and physical. Some of the common symptoms of compassion fatigue can include bottled up emotions, sadness and apathy, inability to get pleasure from activities that previously were enjoyable, isolation, difficulty concentrating, feeling mentally and physically tired, chronic physical ailments, voicing excessive complaints about your job, your manager, your coworker. Does this sound familiar to anyone? Lack of self-care, including poor hygiene and a drop-off in your appearance, recurring nightmares or flashbacks, substance abuse or other compulsive behaviors such as overeating or gambling, or maybe not even eating enough. So, what do we do about compassion fatigue? The first step is awareness and the accepting of compassion fatigue as an occupational stress or hazard of the work we do or coming from having pets in our life, especially when they have chronic illness or cancer. By looking at it from a three-pronged approach, that can help for pet professionals. Firstly, there's an organizational responsibility to care for staff. Secondly, an obligation amongst peers to support colleagues. And thirdly, a personal responsibility to care for oneself. For pet parents, we need to create boundaries and ensure we are taking care of ourselves, but also being kind to ourselves. So some of the things that you can do, find someone to talk to. Understand that the pain you feel is normal, especially with a cancer diagnosis in your pet. Make sure you're exercising and eating properly, getting enough sleep, taking time off. Wow, I know as a pet professional, that's a really hard one. But also, if you're helping a pet that has cancer, make sure you're taking time out for yourself. Develop interests outside of medicine for any pet professional that's here. Take up knitting or something else that's exciting for you. Something outside of medicine so that it doesn't involve your entire world. Identify what's important to you. That may be meeting up with a friend once a week for a coffee, once we're allowed to do that. And then, of course, the things that you don't want to do. Don't blame others. Don't make drastic decisions like looking for a new job, buying a new car, thinking it'll take it all away. Fall into the habit of complaining with your colleagues, working harder and longer, self-medicating, and don't neglect your own needs and interests. Self-care is so important for building our self-resilience. Through meditation, exercise, diet, and sleep, we can optimize our health. Positive relationships and support are very, very important. Along with positive relationships, make sure you're reducing time with people who may be bringing you down. Supplementing our diets with vitamins and necessary minerals can also help us feel better and optimize our health to handle stress more effectively. The way I remember this is meds and RX, meditation, exercise, diet, sleep, relationships, and X factor for your supplements that you need. Do you have routines in place to help provide some sense of normalcy to your day? In the pet profession, our days can be filled with chaos and reactivity to emergencies and client needs. Grounding yourself with a morning routine and checking in during the day to see how you're feeling are very, very important. For pet parents, what does your morning look like? How many times a day do you check social media or the news? Do you have a gratitude journal, or are you even expressing gratitude throughout the day? And what is your nightly routine? When we're helping our pets with cancer, this can be really hard because they take a lot of time to care for. And we can also feel like we're losing some of that gratitude watching our pets be sick. But this can help ground us, give us a sense of normalcy, and also remind us of the important things in our life. Remember to play with your pup and be present, especially with a cancer diagnosis. They appreciate the extra attention and time. Even meditating and sitting quietly with your pet, expressing gratitude for the time you have with them can help heal your soul and take you out of the blame and grief phases of compassion fatigue and stress. If you're experiencing strange symptoms that no one seems to be able to explain, they could be arising from a traumatic reaction to a past event that you may not even remember. You may be experiencing compassion fatigue or burnout. You are not alone. You are not crazy. There is a rational explanation for what is happening to you. You have not been irreversibly damaged, and it is possible to diminish or even eliminate your symptoms. Start implementing some of the previous tactics into your life to help you heal, and never be afraid to reach out for help if needed. And remember, you don't have to implement all of these at once because it's not to create more stress. It's to make this easier for you and to help you. So start with one if that seems right. So we're going to go through some slides on how KarmaSue is helping families and pet professionals, especially when their pets are diagnosed with cancer. So pet professionals like vet techs and veterinarians, they also feel this way along with pet parents. And maybe you'll find as I read some of these that you're feeling this way recently, especially if you have a pet that's had cancer or maybe has passed from cancer. You might be feeling helpless, devastated, lost, exhausted, emotionally detached, yet also so very sad. Such a strange feeling to hurt so much and yet feel so completely detached, purposeful yet purposeless, relieved and guilty, obsessed about making every moment great for him, worried about ending his life too soon or too late, obsessively worried about this, angry at the world, ate bad food, did not take any time for me, let my human relationships suffer, grieve before he was gone, obsessed. Who here has ever felt any of that? I know I have, especially with my dog passing recently. There were a lot of those emotions that I felt. So what are some of these tips? These are some of the ways that KarmaSue families have recovered from compassion fatigue that you can utilize for yourself. Lean on others. Find time for yourself. Find ways to replace the sacrifices you are making. Don't feel guilty when you don't do something right. Give yourself time to grieve. Connect to other animals in the house. Seek counseling. Remember that all feelings are valid. We all feel things differently, and that's a really important thing to remember. We have to embrace the journeys that we're on and that they're all going to be different. However, there's amazing resources like KarmaSue that help people navigate that journey. So having pets with cancer is hard. Even as a vet, I still experience symptoms of compassion fatigue with Finn, especially on nights when we were up all night with him. However, being thankful and grateful for all the time we had, even if it was still too short, was something I did every day. We have so many pictures and videos because we knew his time was limited. Cancer is a blessing. I know that sounds weird, but it's also a curse, and your world is turned upside down when you hear that C word. However, you know that your time is limited with your pet, so you want to make the most of whatever time you have left. It allows you to slow down and be present. Give yourself grace and just love on those pets, and make sure to reserve love for yourself during this emotionally difficult time. And remember, as the slide said, some of the things that you can do right. You didn't wait too long to make important decisions. I find that clients, whenever that decision is made, it's the right decision for them. You took tons and tons of pictures because you knew their time was limited. Take them on adventures. That might mean an adventure to the backyard for more sniffs and smells. And you love them to the best of their ability in that situation. That can be different. Sometimes that love means giving them time to rest. And so it's adapting to that cancer situation and just giving them all you can, but remembering to take care of yourself. So let's not forget about those pets with their stress. And these are our pets with cancer. There are pets maybe in our household right now with us being stressed out with all the changes. What are some of the ways that we can help our pets naturally with stress? So let's talk about supplements. We're going to talk a little bit about CBD, some herbal medicine, the nutraceuticals, calming sprays, and essential oils that you can use safely in your pets. CBD, this is a huge hot item out there, and CBD is very, very beneficial for cancer patients. You always want to make sure that you're working with your veterinarian, especially if they're on other drugs or medications, to ensure that the CBD is not going to complicate things or cause any reactions or side effects. But we need to remember that it's kind of a wild west out there. How do we know these products are decent? How do we know they're good? We're hearing all the time about how CBD is good for cancer, it's good for seizures, and I know this was part of Finn thriving for 10 months with a brain tumor. So there are good products out there. So first, the way to analyze whether a company is good, do they have a certificate of analysis? This is going to tell us if there's truly CBD present. What is the terpene profile? Is it an isolate, or does it have a broad spectrum? Is it full spectrum of different terpenes? What is in it? Does it have any bacterial contamination? Does it have any fungal contamination, heavy metal contamination? So this is going to tell us if the product is pretty good. So if a company does not have a certificate of analysis on their website, you need to call them. If they can't answer the question, you don't use the product. The next question would be, how is this processed? So is it processed with chemicals? Is it processed with CO2 gas? This is very important because this ties into the certificate of analysis. You want to know if it is processed with chemicals, is some of that chemical still present in the product? Because if it is, you will be giving that to your pet. And if we're talking about pets with cancer, we don't want to be putting more toxins into their body. Next is, what is the concentration? So this should be on the bottle and very clearly stated with like mgs per mil. That way we know what the concentration of CBD is per milliliter of dosage. So that's going to help us decide what is the appropriate dose we use for our pets. If we don't know how much CBD is present in a drop or a mil of that product, then we can't appropriately dose that pet. We can overdose them, we're underdosing them. There's probably not enough CBD in there to make a difference. So that's very important to know. The dosage is going to be given to you by a veterinarian that you're working with. So there's different dosages, whether you're using it for seizure reduction, to help with cancer, if you're using it to help with anxiety, those are all going to be different dosages for your pet. And then also, is it organic? We don't want to be adding more toxins into our pet's body. So you want to ensure that the product is organic. And some of the ones that are quality and safe that I recommend, that I've used quite a bit, VetCS, RX Vitamins, and RX Vitamins Hemp, and Earth Buddy are just a couple. There are a lot of really good brands out there. And there are also, remember, a lot of really, really bad brands. So we want to be careful, because I find a lot of pet parents mean well, but they end up wasting a lot of money. And CBD can be very beneficial for helping our pets navigate cancer. Some of the other options. So when we're talking about stress in our cats and our dogs, there's a couple pheromone products that are great to try. So Feel Away is a cat pheromone, and it's like a Glade diffuser plug-in, except for it's releasing cat-happy pheromones. And so it's safe. It's not like a Glade diffuser. That's not safe. So if you're listening and you have a Glade diffuser, here's my disclaimer, throw it away. So the Feel Away, though, is safe. So when your cat rubs up against furniture, it's releasing these feel-good pheromones. They've taken it, they've bottled it, and now you can plug it into your wall and have it diffuse throughout the room and help your cat feel happy. The dog version is Adaptil. And so these are great options to put in the room that your pets are spending the most time. If you're noticing any of those stress symptoms, or you're noticing you're really stressed out and you're wondering if maybe your pet is stressed out. The other option you have that's very safe is a treat that's from VetraScience called Composure. And they utilize B vitamins and milk proteins that have been shown through different research studies to help calm down anxiety and stress in pets. So those are a great option to throw in as a treat. There's also music. So through a dog's ears, you can get the CDs, you can get, I know CDs are pretty obsolete now, but I think you can download versions like MP3s to play on your TV, on your computer. You can play these for your pets. And this works for dogs and cats. And it's calming for them. And it's actually pretty calming for people too. I've used these in my acupuncture appointments. And so that's something to use in adjunct to some of these other treats, the Feel Away, the Adaptil diffusers. And then one of my favorite things that I love utilizing that most people don't know about is calming teas. So we can actually use tea, yes, human tea that we drink. We can use that for usually just our dogs, because cats, you could try mixing it into their food and see if they eat it, but most dogs are going to eat the tea mixed in with their food. So brew a cup of lavender and chamomile tea and pour it into your dog's food, and that can help relieve their anxiety and their stress. And if you're feeling stressed, brew a cup of tea for yourself. And everyone gets a cup of tea together. And if you're finding that your pet is having a hard time sleeping through the night, go ahead and give them a small meal before bedtime and add that tea to it. And you may find it's just enough to help calm them down. So essential oils. I love essential oils. They're so powerful. They're the plant compounds, very concentrated, and they work really, really well for different conditions. Now, the biggest thing to keep in mind with essential oils is that we want to use therapeutic grade, high quality, organic essential oils. So there's a lot of brands out there that add in artificial fragrances, and this is what usually causes issues with our pets. So we'll hear about, oh, this pet had a reaction to essential oils. All essential oils are bad. Usually that person was using a poor quality essential oil. We have to be careful with cats also, because they lack certain enzymes in their liver to detox and metabolize certain essential oils. So one of the great ways to introduce essential oils into your household for your pets is to get a diffuser. And that way you can diffuse essential oils in an open room that allows your pets to come and go as they please. So if they don't like it, they can leave. So you never want to trap them in a room and diffuse essential oils. So this is a great way to start. One drop in your diffuser, and diffuse it and see how they respond. Dr. Melissa Shelton has a company called Animal EO. This is a really great essential oil company for dogs and cats that you can go on there, and pretty much any condition, you can find an essential oil blend that you can use safely for your dogs and cats. Some of the other companies that have been around for a long time that produce quality essential oils would be Young Living, doTERRA. Remember, we need to be careful around cats. There's certain essential oils that we need to have more care with also, like tea trees and wintergreen are a couple that we need to be careful with. So if you're not sure and you're looking to reduce stress, you're looking to reduce anxiety, lavender, chamomile, just like your teas, remember essential oils come from plants, are great starting options. 1 drop lavender, 1 drop chamomile in your diffuser, and diffuse that in an open room. And then you can slowly start increasing your use of essential oils from there once you know your dogs and your cats are doing well. The important thing too with essential oils is making sure they're organic. This is the same thing with teas that I don't feel like I mentioned previously. We want to make sure the teas that we're using are organic. So here in Colorado, I know we have Traditional Medicinals tea brand, which is a great option for your pets. And I know they have lavender and chamomile together in 1 tea bag, and because I use it for myself. So check that out and see if that helps your pet. And don't forget to have a cup of tea with your beloved pet at the end of a long day. So that was some brief information on some natural holistic remedies on how to help your pet stress. And a nice side effect from those is that a lot of that actually helps you too. So your teas and your essential oils can help calm you down, help you de-stress from the end of a long day, help with that self-care routine that is so important for battling compassion fatigue. When we're helping our pets with cancer, if you're a pet professional and you have a really stressful job, because we do. And so as a summary, like support, who is your support network? If you don't have one, make sure you're reaching out to people that can help you. Self-care, what are you doing for your routines? Are you meditating? Are you exercising? Are you eating appropriately to take care of your body? Those are all really important things that we need to look at and be incorporating into our day. Be kind to yourself. It's very easy to do negative self-talk, especially once we start getting down on ourselves. So remember to give yourself some grace, give yourself space, and be present with your pets. When our pets get cancer, it's really, really hard. I've been there 3 times with my own pets. And there's never enough time anyways when they don't have cancer, but the time's even shorter when they develop cancer. So make sure you're spending that time being present as much as you can versus worrying or blaming or being angry over that diagnosis. Yes, we all go through it, but don't let it take up 100% of your space. And support yourself and your pets with natural remedies to help lower that stress that you're feeling, because it's normal to feel that. Remember, stress, there's a normal stress. It's when it goes on to be chronic stress, that's when we start developing problems. That's when we can start entering compassion fatigue. We can enter the burnout phase. So make sure you're supporting yourself with natural remedies versus using things like wine and alcohol to reduce stress, because that never helps. And if you're feeling lost and not sure where to turn, make sure you check out KarmaSue. KarmaSue is an incredible nonprofit that helps pet parents with many different aspects when your pet receives a cancer diagnosis or passes away. The vision of KarmaSue is to provide support to families in Colorado seeking resources after a companion animal receives a cancer diagnosis. Programs include education regarding cancer and other health topics like this one, treatment options, plus how to maintain a healthy lifestyle, grief and compassion fatigue counseling, and other outlets for grief, and financial support, including connections to additional resources if needed for veterinary costs related to a cancer diagnosis and associated treatment. I love being here today because KarmaSue is creating a huge impact for Colorado families in need. Receiving a cancer diagnosis for your pet is one of the hardest things to hear, but KarmaSue is there to help families and pets as much as possible during that difficult time. Right now is a financially hard time for so many people, but if you are planning on making a donation to any pet nonprofit, please give a little bit to KarmaSue today. 60% of pets will develop cancer at some point, and KarmaSue has a huge mission to help as many families and pets as possible, and they need us. And remember, if you're in need for yourself or your pet, KarmaSue is here to help. So we're gonna wrap up. So for holistic pet care, for your pet, if you have questions about holistic pet care, there's not a lot of holistic veterinarians, make sure you subscribe to The Natural Pet Doctor. We have a free weekly newsletter on free tips to how to help your pets thrive. Make sure you follow us on The Natural Pet Doctor on Facebook, Instagram. We have free videos on YouTube. If your pet has allergies, check out our YouTube video. We also have a lot of information on cancer and managing that holistically. So please check out our website at thenaturalpetdoctor.com. So once again, thank you so much. And what we're going to do is we're going to answer any questions that you have about managing stress in your pets and yourself. So I'm going to stop my screen share so I can see. Okay, perfect. Okay.
Are you ready for some questions?
I am.
We do have a couple, and if anyone has any others, please feel free to put them in the Q&A box. We're happy to answer them now. Liz, she had a little bit, she would like a little clarification on teas. Any specific type of tea? Some have caffeine. I know you mentioned chamomile and lavender.
Yes.
So can you expand on that?
Yes, definitely. That's a great question, Liz. So chamomile and lavender are going to be naturally caffeine free. So you should be okay with those. So what I usually say, if you're giving, so let's talk about dogs and giving teas to dogs. If you have a little dog, so let's say roughly 20 pounds or less, I would start with a 1/4 cup of tea. So you're brewing a cup of tea, you're going to measure out a 1/4 cup, and then you're going to mix that into their food. If they're a medium-sized breed, so 20 to 55 pounds, then I would say do a 1/2 cup of tea per day. So you can just do this once a day. You can also split up that and do it morning and evening. And then for a large breed dog, so if you're having 55 and higher, then you can do a full cup of tea. And you can play around with that. Chamomile and lavender are really safe for pets. And if they're on any medications, there's not going to be any reactions, which is good. Now, some of the teas that, if you've followed any of my stuff, I talk about teas a lot because there's a lot of therapeutic properties about tea. Green tea is a really common one that we add into pets' foods for extra antioxidants. We use it for allergies. But that has caffeine. So if you have a dog that is already off the walls crazy, you probably don't want to be adding caffeine into the mix. And so what you can do is to remove some of that caffeine is cold brew it. So what that means is putting the tea bag in a cup of cold water, put it in your fridge overnight, take the tea bag out, and then you can pour that cup of water, that cold brewed tea, into their food in the morning. And that's going to remove some of the tea or the caffeine. So
that's interesting. I've been learning a whole lot over here. All right, next question is from Ryan. What are some of the side effects of conventional anxiety meds?
It's a great question, Ryan. So there's lots of different anxiety medications that are conventional. And so there is a place. So I'm not against conventional. I'm about integrating holistic into conventional. And we use that a lot when we're treating cancer patients. So I see a lot of pets that have cancer, and most of them receive chemotherapy. So we add in herbal medicine. So the same with anxiety. And a lot of the pets that come to me, the pet parents want to get their pets off of those anxiety drugs. And so let's talk about cats. So cats are a common one. So they're stressed out, they're destroying your house, they're peeing all over, they're peeing outside the litter tray. That's their way of showing that they're stressed usually. And as a pet parent, we don't usually tolerate that very well because they're destroying everything. And so we put them on like kitty Xanax or kitty Prozac is a common one. And what happens is those cats essentially lose a personality. So they just sit there and stare into space. And I know this because years ago, before I did holistic medicine, I had a cat that was destroying my house because she was stressed after making a long trip from New Zealand. And she was stressed and didn't know what to do. So I put her on kitty Prozac. That's what we're supposed to do from conventional medicine. And she just sat there and stared into space. Now, other anxiety medications, they can affect the liver. When they're on these medications, we need to be checking kidney and liver values to make sure they're not being harmed over the long term. So that's something to be aware of. Now, what's really nice is that if your pet's on an anxiety medication, is that usually you can implement some of those things we talked about. So using your teas, using the diffusers, using essential oils, using the calming treats. And there's a lot of other things that you can use too, like thunder shirts, or if you have noise phobias. And by integrating and using these products synergistically, you can find that you can either take your pet off gradually. You never want to take them off right away off of that medication. So you want to wean them off of that. But a lot of times we can get them off of those medications or to a really low dose that hopefully we're not going to see any of those side effects.
Interesting. A question from Desiree. Do you have any advice on how to handle one pet grieving over another pet that has passed?
Time. And also that is, Desiree, that's a great question, and it happens all the time. And one of the things that's really hard, and this is something that comes up frequently, is that when pets grieve, what I find is that the biggest thing is if that pet hasn't been seen by a veterinarian and you're finding they're grieving longer than a month and they're having troubles eating or they're depressed, they don't want to do anything, make sure you take them into the vet clinic to have blood work run, because I've found that a lot of pets actually have an underlying condition and that grief puts them over the edge and they can actually get sick. So we want to make sure that that's not happening, because grief is a real thing. So if you have a pet that's grieving, you want to give them space. You want to give them time. You want to also, if they're more needy and they need attention, give them that attention as much as you can. But also you can utilize those things that help reduce stress. And if they love going to the park, take them to the park, throw the ball for them. It may be one of those things too. If you're ready, this isn't always easy for people, but if they were really bonded to that pet, even bringing another pet into the household or fostering a pet can help those pets recover and gain a new friend. So that doesn't always work, but if you're fostering, you'll have a better idea if that was going to be helpful for your pet that's grieving.
That's great information. Another question from Ryan. Any anti-cancer foods to add into their diet?
That's a great question, Ryan. Yes. So if your pet is on a kibble diet, you want to start adding in veggies. So lightly steamed broccoli, lightly steamed spinach, kale, adding in carrots. So you want to feed the rainbow, just like us. And the reason why is those vegetables have a lot of antioxidants in them. And there's a study, a 2002 study by Purdue University that is never brought up by conventional vets, and it kills me, is that they showed that by feeding pets 3 times a week, leafy greens, 3 times a week, that's it, like kibble diet, it reduced their cancer risk by 90%. Like that is a huge statistic. And so if we can do that before hopefully they have cancer, fantastic. We may be able to prevent them from developing cancer. Like I mentioned, 60% of pets will develop cancer. That's a huge number. And so if your pet has cancer though, adding real food into their diet can help tremendously getting those antioxidants and nutrients that they need.
Those were all of the questions right now, but Carrie wanted to say thank you for doing this Zoom meeting. She said it was very informational and helpful, and it helps her as well. She created Pause for a Cure in memory of her chow. that lost his battle to cancer in 2007. So she wanted to say thank you, and she's in tears writing this, but you're with the right group, I think, Carrie. So we feel it, and we send you lots of love and light.
Thank you for being here.
And Ryan also said thank you as well.
Thanks everyone for being here. I appreciate all of you, and thank you so much, Britt and KarmaSue, for doing all the amazing things that you do. Like, I love your mission. I love your vision, and you guys are incredible.
Thank you for doing this for us. I think we learned a lot today, and we really appreciate it.
Awesome. And thank you everyone for being here live and taking time out on a Friday afternoon and supporting. So I know we all appreciate it. All right. Have a great rest of your weekend.
Thank you. Thank you all.